Welcome to the Gerontological Society of America's Momentum discussion, where we explore groundbreaking topics in the field of aging.
Welcome to this GSA Momentum Discussions podcast episode titled When Opioids Help and When They Harm Older Adults, developed by the Gerontological Society of America. Momentum discussions highlight topics experiencing great momentum in the field of gerontology. My name is Elana Kieffer Blass. I am the Director of Strategic Alliances at the Gerontological Society of America, or GSA, and I am pleased to serve as the host for today's Momentum discussion. Today's episode takes on a critical topic that most of us have little or no awareness about: opioid use among older adults. Our guest will share her research and personal journey in this field and one small and easy step each of us can take to address it. Bethea Kleykamp is an assistant professor in the Psychiatry Department of the University of Maryland School of Medicine and the Director of Research and Evaluation for the Maryland Addiction Consultation Service. She is a PhD-trained experimental psychologist. After completing her postdoctoral training, she pursued a non-traditional career path, holding science writing roles in the nonprofit, for-profit, and public healthcare sectors, including the American Society of Addiction Medicine. In 2021, her growing recognition of the lack of research at the intersection of aging and substance use and growing older adult population led to a full-time return to academia in 2023. So let's get started. Annie, welcome to the podcast.
Thank you.
Why is it important to talk today about older adults and opioid use? What do we already know about this topic, and what are some misconceptions around it?
Yeah, so I think the obvious that many of us know is that opioids are prescribed, and older adults are often those that are prescribed most commonly opioids. Now, that's decreased in recent years as concerns over the opioid epidemic or the impact of drugs like heroin and fentanyl on the population, which has been driven in part by prescription opioid overprescribing. And so, what we're seeing now for older adults are fewer prescriptions for opioids, but still a significant amount. And of course, this is for pain, this is for end of life care. So there's a really important clinical need for opioids. At the same time, older adults have been disproportionately impacted by the opioid epidemic, and this has often gone undiscussed. And so what that means is older adults are the most likely to die of a fatal overdose. And where I live in Baltimore, it's unfortunate that it's the overdose capital of the country, and adults 55 and above in our area are most likely to die. And we think there's a variety of reasons for that. Often, this is not due to prescription opioid use. This is due to drugs from the street, including a synthetic version of opioids called fentanyl, which is very deadly. And we think that older adults, especially, are at risk because they already have other comorbidities. Maybe they also smoke cigarettes and they have respiratory complications. And so their risk of actually dying from an overdose is much higher, especially when fentanyl entered the market about 10 or 15 years ago. Misconceptions, I think that there's a lot. I think that a lot of people are fearful of opioids when they're prescribed, thinking they could automatically become addicted. And many people safely use opioids and need them for pain, end of life care. Maybe they've had a surgery and it's just a short term use, and they don't go on to develop what we call addiction, which is that uncontrolled use that can harm your life. But I think another misconception is that older adults don't use drugs recreationally. And what we're seeing with the opioid epidemic is that there are a lot of older adults that still use drugs that aren't prescribed that are opioids. And there's a lot of information that we don't have on how to help them because older adults are often excluded from our research. And so I think having this conversation is so important so we can talk about the benefits and risks of these drugs and also put light on this population that does intersect with opioids quite a bit.
And is there any research on older adults who are using opioids that they're starting when they're older, or has this been like a lifelong struggle?
There is some research to suggest what I think some research studies have called late adopters, where maybe they had no previous experience with opioids. I would say that's a smaller proportion. You don't generally see people suddenly develop an addiction later in life, even if it's something like alcohol or tobacco. You do see signs of that usually earlier, but it is possible. So it's possible to, for example, never have moved into risky substance use or had an addiction and suddenly that come on in older age. And they think that some reasons for that are your metabolism changes. You may have social circumstances that make it more appealing to check out with drugs like opioids. And so it is a risk unique to older adults. Although I would say most people who we see like in our treatment clinics have struggled with this for many decades.
Yeah. And this is obviously not an easy topic to talk about. So, can you talk about how you first got interested in it and also what has kept you in this field?
Yeah, it's really special to talk to you about this because since I was born, I was in a family that was directly impacted by opioids. My father had prescription opioid dependence when I was born. He was lucky enough to have access to inpatient treatment at the Betty Ford Clinic that he went to when I was 5. So I grew up navigating as a family member his dependence on opioids and then his post treatment. And he did continue to struggle with opioids and other drugs, including alcohol, throughout his life. And his struggles and mine as a family member were the direct reason I went on to study addiction with my PhD. He unfortunately passed at age 63. And I learned after the fact, although I had suspicions that he was still struggling with opioid use. And that's really important to me because that was in 2014. And I always had an interest in aging and substance use. But I saw that my dad was able to use drugs and he was a physician and he went to special treatment for physicians. He probably had some of the best access to care.
Wow.
And I saw that that impacted his whole life. And there were a lot of reasons that he was using substances that weren't at all related to medicine. They were trauma and stress. And so I really take that experience with me into this push that I'm doing to focus more on older adults with opioids. The other part of that is that we're talking about opioids today, but often they intersect with other substance use. And so that's something to keep in mind. It's easy to think of substances singularly and think, oh, if I could just help someone that may be having issues with opioids. But often we're balancing lots of other substance use issues or mental health issues with that.
And what has kept you in this field?
Oh, yes. I would say just a persistent drive to understand my personal experience, how this can happen, how someone like my father or many of the people that I see in my research studies can struggle for so long, even though we do have a lot of tools to help them. And I think what really motivates me is that there's so much work to be done. I already mentioned older adults are excluded often from research, especially in substance use. So there's a huge gap there. So that really motivates me to fill that gap in our understanding. But also, I'm motivated to educate people and to, I guess, spread the message that it's never too late, that there's always opportunities to address if you have an addiction or a dependence on opioids. And it's not going to look like the same for everyone. And there's lots of options that include harm reduction, not just cessation of the drugs that can help people. And that really motivates me because I think what I want is for family members and people directly using opioids and other drugs to feel hope. Even
Mm.
though they may have been using them for a long time, there's a lot we could do to help.
Yeah, definitely. So, of course, one major concern about opioid use is the risk of an overdose, which could certainly lead to death. So, what are some concrete steps that we can take as a family member, a caregiver, a neighbor, or a friend to help prevent an opioid overdose?
Yeah, I think first, being aware and knowledgeable. One, is it possible to know if they have a prescription for opioids or are using them or have access? And then knowing the signs of a potential overdose, which could be very slowed breathing or not breathing. They often point to blue gray lips or pale skin. I would say lean towards being extra vigilant about that. Older adults can often really quickly move into these overdose signs. And so, what that could look like is, of course, if you've seen these signs, you're educated on them, you call emergency services. And I think the really big win for public health is something called naloxone, which is a medication that you can easily get. I have it here just in case somewhere in my community in Baltimore, someone's looking like they may be suffering from an overdose. And that's a safe medication that can stop an overdose in its tracks and save many people. And there's lots of tools. I know GSA has put out tools on how to use naloxone, really easy to learn to administer it. So I think having that on hand and having that with you. The other part is checking on people. So it is the case that a decent portion of people who overdose and pass away are alone. And there may be older adults that are using substances. Maybe it's all prescribed and they don't have any signs of addiction, but they could be at high risk. So being able to check on them or making sure they're being checked on would be really important to be able to intervene early.
And can you just talk a little bit more about naloxone? As you mentioned, GSA has written a report and a decision tool about it. Can you just talk about how to get it and also what happens if you give it to someone and they're not overdosing, just to quell some fears and
Yeah.
just show just how easy and safe it really is?
Yeah, so there in your community, there's a lot of free access to naloxone. In Baltimore, you can get it for free. You can contact your local health department. You can also access it through a pharmacy, purchasing it, or you can talk to your doctor about it. The most often way to administer it is a nasal spray, and it's safe. It's safe to administer even if someone is not experiencing an overdose related to opioids. So, one thing to keep in mind is they may be showing signs of sedation that aren't due to an opioid. And so, the way naloxone works in the brain is it's going to block the effects of an opioid. But if there may be another drug, sedatives, for example, like a benzodiazepine, it wouldn't block that, but it would block the opioid overdose. So, that's why it's important to also be contacting emergency services just in case there's another medical or substance that's there. But I would say the guidelines suggest if you're in doubt, you think that it could be a chance, it's safe to administer it. And there's lots of online videos and training and different ways to learn about it. And so I would really urge people, if they're interested in looking at it, reaching out to your local health departments or even just talking to your doctor about it. And if you're prescribed opioids, you can also talk to your doctor about also getting naloxone along with that in case you're worried that you may take too much.
And that leads to my next question, which can you just talk a little bit more about prescription opioids? Of course, we're working at GSA across the life course, but really focusing on older adults. And many older adults, and again, many of us of all ages, will be prescribed opioids for a variety of reasons. So, can you just talk a little bit about how to balance that? Because we don't want to scare people away from taking opioids if they need them for, as you mentioned, for pain relief, end of life care, and the like. Just how does one balance that?
Yeah, I think, for example, if you're having a surgical procedure, your provider that's going to prescribe the medication is really going to weigh these risks and benefits, and they're going to prescribe you the amount that they think is safe and talk to you about that. There's a lot of research to suggest that treating the pain can help you heal faster. And so I just want to reiterate, if you do have pain and you've been prescribed opioids, taking those is not going to instantaneously lead to addiction. There's many people that safely take opioids. And so I would say don't let that fear stop you from using this tool that medicine really has for us to help us live a healthier, more high quality life. A lot of people have chronic pain, and there's a lot of discussion about the role of prescription opioids in that. Your doctor will decide, and more doctors are restricting access to chronic opioids, but seeing a pain management specialist, so someone that has expertise in that, if you do feel like opioids are the only thing helping, could really help. And I would recommend that if you are prescribed opioids, following the instructions on taking them, even if you want to take more, and not replacing them with anything that you get that's not prescribed, because that can be really risky. If, for example, you were to purchase some from a friend or someone on the street, and that's because what we know is with prescribed medications, they're FDA approved. So they're really going through a lot of rigorous testing. On the street, we're unfortunately seeing that opioids are mixed with a lot of other drugs, and including cocaine, and this could be really risky. So if you find yourself needing more, I think having that conversation, that honest conversation with your doctor, because there are ways to pair opioids with non-opioid medications for pain that can reduce your use of them. And I just think that there's some research to suggest that many people will not accept opioids for fear of addiction. And that's definitely a conversation to have with your doctor, because there is a true benefit in them. And I saw it recently. I unfortunately lost my stepfather to cancer December 1st. And I was with him those last 2 weeks, and he was with hospice. And the availability of pretty serious opioids towards the end of his life was critical for helping him live that more comfortable life. And then up until a couple months before, he was very hesitant to use those. So I would think understanding that opioids are approved by the FDA and available as medicines for a good reason, they have benefits, but also appreciating the risks and watching yourself and the signs that you could be developing some dependence to them that maybe isn't in your best interest. So that could look like maybe you need more and more of the same dose to have the same, or a higher dose to have the same effect. Or maybe you find yourself wanting to use them when you actually aren't experiencing pain, or if you are seeking them outside of the context of your doctor. So you can keep an eye on those things. And also, if you have family members, if you're concerned about that, they can help you keep an eye on it. So I think that's a really long way of saying it's complex, because opioids do have these benefits and risks, and each person will have a little different scale. If they have the pain and a low likelihood of developing an addiction to them, it could be a medicine that their doctor thinks is reasonable, especially in the short term.
Definitely. And I think also one way to mitigate the fear of someone who might need to take prescribed opioids and be nervous about it is like information is power. So, as you just said, if you can learn to recognize the symptoms, if you are concerned about an overdose or a dependency, to make sure you have naloxone nearby, to make sure you know how to use it, to make sure that others near you know how to use it, that can all hopefully help with that. And then also allow people to take opioids safely.
Yeah, exactly.
So, my final question today is, what is one takeaway that you want our listeners to understand after listening to this episode?
I think my life experience with my dad, and also working with a lot of patients that take opioids, I think my bigger picture is there's a lot of judgment around drugs and stigma, even if you're prescribed them. And opioids have really risen on that list because of the opioid epidemic. So I think my main take home point is, if you are a person taking prescription opioids, or you're taking opioids recreationally, I think, or a family member or friend, I think removing the character evaluation from that. There's this history of evaluating people on their substance use, suggesting they have some sort of moral failure. And the truth is, these are drugs that impact the brain in important ways, and they can reduce pain, and they can also elicit addiction. But that is not something you have full control over. So if you find yourself using opioids in a way that's not benefiting you anymore, I think trying to approach it without the shame, the self shame, or shaming your family members. There's a lot of solutions and resources out there. We mentioned the American Society of Addiction Medicine. Clearly, GSA is doing a lot. And it really is more of a medical issue than anything else. And so, if we can keep our eye on that and seek out the medical care we need, the information, like you said, resources, I think that can remove a lot of the silence that's around substance use, including prescription opioid use, because there's just so much shame that keeps people not talking about it. And if we don't know that people are using opioids, we can't help them if they run into something like an overdose, or maybe just they get into a pattern that they want to stop, but they need help with that.
Yes, I deeply agree.
Mhm.
But Dr. Kleykamp, thank you for taking the time to join me for this podcast episode. And most of all, thank you for your research, your passion, and your action on this topic of older adults and opioid use. Thank you also to Emergent BioSolutions for their support of this podcast. And thank you to our listeners. We hope you found today's episode enlightening and informative.
Check out GSA Enrich at geron.org/enrich for engaging learning resources, including toolkits, publications, webinars, podcasts, and more.